Rash. The rash is the appearance of injuries on limited areas of the skin's surface as a result of abnormal changes in the skin. These injuries can take the form of color changes in the skin, or they can be raised above the level of the skin's surface and contain solid or liquid content, such as blisters or bubbles. Rash manifestations. Aside from the distinctive rash, several small alterations to the skin may emerge, such as itching, scabs and crust appearance, skin deterioration, burns, scars or itching markings. The rashes can be extensive and cover huge amounts of skin, or they can be limited to a small area of skin or many skin locations. Rash causes and risk factors. Because many different systemic diseases produce effects or symptoms on the skin, the rash could be a manifestation of a skin disease, a general sickness, or a systemic disease in a number of body systems. The most common causes and contributors are: 1. Become infected with a virus. The most prevalent cause of diseases are those that are caused by a viral infection and manifest as a rash with a fever, and these diseases are referred to as pediatric diseases due to their great frequency among children. When these diseases first manifest in childhood, they build lifelong immunity, and they include measles, measles in Germany, rubella, roseola, parvovirus infection, varicella, chickenpox, and others. The spread of measles and rubella is rare today thanks to vaccination programs for children against the viruses that cause these diseases during the first 15 months after birth, and it is expected that vaccination programs will also be implemented against the virus that causes varicella, implying that the disease will be eradicated permanently thanks to the successful vaccination. Enhance it. In addition to these 5 diseases, there is another group of viruses that cause skin rashes and high body temperatures. The Coxsackie virus produces skin rashes, fever, and occasionally diarrhea, and its prevalence rises in the summer. Foot and mouth disease, infectious mononucleosis, West Nile fever, and other disorders are all included in this category. Infectious disorders caused by bacteria. A vast set of infectious disorders produced by diverse microorganisms, the infection of which is accompanied by the emergence of skin rashes, in addition to the causes of the disease. Among the most common are typhus. Meningitis is a condition that affects the brain and spinal cord. Fever scarlet. Syphilis is a disease that affects men. Lyme disease and a variety of other illnesses. 3. Direct contact with biological materials. A vast number of disorders caused by exposure with biological warfare ingredients are also accompanied by skin rashes, such as anthrax, smallpox, and the Yersinia bacteria that causes it, is also known as the Black Death because of the epidemic that swept Europe in the Middle Ages, killing a third of the continent's population. Rabbit mania, Tularemia. Viral fevers that are accompanied by bleeding. 3. Non-communicable illnesses of the system. When dealing with non-contagious systemic disorders, it is important to detect the indications that occur on the skin, such as metabolic problems, endocrine problems, collagen-related disorders, autoimmune conditions, cancerous tumors. These disorders include skin signs and symptoms, and recognizing them could be crucial to diagnosing the disease. When diseases that cause damage to connective tissue compounds, such as damage to many other organs and organs in the body, including the skin, the diagnosis of such diseases is focused mostly on the signs and symptoms that show on the skin, because they are the most evident, such as vasculitis. Damage to blood vessels occurs in many essential organs of the body, including the kidneys, lungs, neurological system, and others, but the disease's diagnosis and stage categorization are based on rashes that can be easily sampled for study. 4. Allergy. In many circumstances, Drug sensitivity manifests itself in the form of skin rashes, while in other cases, the patient is allergic to particular foods or inhaling certain substances, which manifests itself in the form of other skin rashes, such as urticaria. 5. Other ailments. Psoriasis, Behçet's illness, and systemic lupus erythematosus are just a few examples of skin diseases that cause damage to several body systems. In addition to other ailments, the distinction between a skin disease and an internal disease followed by skin marks is not always evident, making diagnosis difficult, and the injured are frequently treated by doctors of various specializations. Unforeseen complications. Complications vary depending on the source of the sickness and the failure to treat it, and there are no specific, well-studied, and established complications related to the rash. The rash's diagnosis. Rashes are diagnosed by looking at identifying the type of original injury, subsequent alterations, size, color, surface, and borders, including determining if the injury's boundaries are regular, uneven, sharp and clear, or merged with the skin's surrounding borders. Determining the location of the infection and how it spreads is one of the most crucial things to pay attention to. It is also one of the factors that aids in the diagnosis of the illness.